Good afternoon. Hello to everyone who's here and who's on Zoom, watching and listening in. Thanks for joining us today. My name is Michele Smith. I'm a registered nurse, and I'm also a certified diabetes care and education specialist. And I'm also a certified foot care nurse. So today our topic is love your feet. And you'll notice that I really can't separate my diabetes hat from my foot care hat. So if you come across some of this information that you might think, well, I don't have diabetes, that doesn't apply to me. But if you have a family member, someone in your life that you've undoubtedly come across who has been diagnosed with diabetes, and you would pass this information on to them, that could help them with their foot care. So that's the introduction. And so we just have some simple learner objectives for the session today. We're just going to explain some basics about proper foot care, identify some things that should be reported when you see a problem, things that should be reported to the doctor or provider, and then demonstrate what you might look for in an exam. And certainly people with diabetes should be doing daily foot inspections for themselves. I'll try that. Oh, there we go. Okay. All right. So just to begin with, as an overview, I'll tell you that we use something in our daily practice called the Standards of Medical Care in Diabetes. And so all the patients that we see in our offices, all the patients that I see in diabetes education sessions are given care and education according to these standards. So because of these standards, it's recommended that beginning at the diagnosis of diabetes and repeated at least a minimum of once every year, people with type 2 diabetes should have a complete foot exam. And so that really isn't something they can do themselves. That's something that should be done in conjunction with a visit when they come to see their provider for their general diabetes checkups. And that's a little bit more involved. It involves checking the pulses. There's two main blood vessels that bring blood into the foot, and checking for sensation, just checking the condition of the skin overall, and checking on the shoes. Are they fitting? Are they causing any problems? But then in addition to that, every visit that the person makes to their medical provider, there should be just at least someone should look at their feet. And even if they say, nothing's wrong with my feet, you checked them last time, those are the kinds of feet I like to look at, the ones that don't have anything wrong with them. So it's all about prevention and keeping their limbs. So how do you take care of your feet? So this is some interaction here. I just wanted to ask in general, are there any, maybe you never thought about it. Maybe you just take a shower, put your shoes and socks on every day, slip into sandals or whatever you're used to wearing, and don't give your feet a second thought. That would be probably the habits of somebody who is healthy and younger and is just kind of taking their feet for granted. But some people would tend to see things on TV or think, oh, I should get that corn pad that has medication in it, or I should use this certain kind of soap, or I should soak my feet in all kinds of things that they shouldn't soak their feet in. People come up with a wide variety of, if they don't know, they're trying to figure out what should their remedies be. And so sometimes they can unfortunately do more harm than good. And some people just in general have trouble seeing their feet, have trouble just logistically getting their foot where, in a position where they can see the bottom of their own foot, look between the toes. So in that case, sometimes we give people a mirror that has an extension so they can hold the mirror down by their side and see the bottom of their foot. Sometimes we ask them to have a family member. Can you have your son or daughter or someone who lives in your home look at your feet with you. So I was just wondering if there was anybody had any foot care stories they wanted to share. Now that you know that you're thinking about it a little bit. Anybody watching in? Oh, I can't hear you. I'm sorry. You're all still on mute.
Yeah.
If you're whoever's listening in.
I was gonna say, sometimes I'll do like the Johnson foot soak or whatever.
Like a soak.
Yeah.
It feels good. It's relaxing and it feels good. Just remember again, if you're young and healthy, you kind of take for granted that you can feel very well. You can feel the temperature of the water, whether it's too hot. And many times people with diabetes might not have that same kind of sensation capacity. So they could injure themselves or get a burn if the water is too hot and they can't test it properly and feel that. So if you think of some stories as we're going along, you can interrupt me anytime and jump in with your stories. I have a lot of my own. I've been seeing patients with diabetes exclusively since 1986. So that's many years of people with diabetes and feet and stories from pretty much A to Z. Okay. So here again, it's just the pulses that I told you about. People could have diminished blood flow into their feet and their legs. And signs that someone has good blood flow are that their feet are warm in general. They're not cold to the touch. They're pink. They look healthy. They're not kind of dusky or light blue colored. That would be a sign of poor sensation or poor circulation, blood flow. And you can actually see this big vessel on the top of the foot. That's one of the main. You can actually feel a pulse. You can feel that pulsing. So just like as if you were to check your pulse on the wrist, you can feel that pulse on the top of the foot. And there's also one back here behind the ankle bone. And that's another good source of measuring how much blood flow is coming into the foot. So we always want the feet to have good circulation because that's oxygen and nutrients for the skin to keep the skin from breaking down. And feet and toes are kind of the most risky because they're the furthest point from where your circulation begins, which is in your heart. So the blood has to pump out of your heart and hit all the way to the tips of your toes. So we don't want anything happening for the patient that might impair this circulation. And it might be a little hard to see, but in one of these blood vessels, pictures on the side of the foot is like too much cholesterol, so that the inside of the vessel is kind of obstructed, so the blood doesn't have as clear of a shot to get through. So we wouldn't want that. We're also concerned about nerves in our feet. And this is something that we all who have healthy feet, we take for granted just every single day. We can put on our shoes and socks, and we know even if our sock is kind of not on properly, it doesn't feel right. We have to fix that, right? We have to sit down and get our socks straightened out so that it feels good in our shoe while we're walking. But people may have damage to those nerves, again, because blood did not supply each of those nerves very well. So you can see this one being normal, And that nerve is just wrapped in healthy little small blood vessels. Here's one that's starting to be more diseased, where the nerve is not getting well nourished by blood. And then here's one that's just, the vessels have completely disappeared. It gets no circulation. So the nerves have kind of shriveled. So we call this neuropathy, nerve damage in diabetes. And this foot with neuropathy is very insensitive. It does not pick up sensation. So the person, it's very dangerous. It's a high risk situation because the person might not notice if there's a pebble in their shoe, or if a new shoe is causing a blister. Any one of us would notice that right away and we would fix that. So they have lost some, it's called protective sensation. So just a word about nerves and blood vessels. Keeping those things in good condition in diabetes is all possible. It's all preventable. And some people aren't even aware of that. They might not be aware that, oh, okay. They might not be aware that they could have diabetes and still have healthy condition of their feet. Hello, thanks for joining. So now we're going to talk about painful or peripheral neuropathy. It's a nerve damage that occurs in the feet. And if not detected and treated, it could lead to just wounds, certainly problems with pain. And people notice mostly at night when they have this kind of classic nerve damage in their feet from diabetes over time. It doesn't happen at the beginning of diabetes diagnosis. I keep losing mine. There we go. So what might look like a really small cut or a small nick in a wound might heal slowly in a person with diabetes. It might not heal at all. And I know for some of you, if you're not medical people, it's about lunchtime and I'm showing you some pictures of foot wounds, so I apologize. But this is a problem. We see these things too commonly. We call it a bony prominence. So there's a bone underneath this lesion that has caused the skin to break with pressure. And maybe the person doesn't feel this foot, but this requires a doctor. So we talked earlier about things that are going to need a doctor's attention. This hopefully had been seen by a doctor, 6 months ago when it wasn't this bad at all. And this over here, just pictures of blisters. Somebody tried out a shoe and they didn't notice, or they didn't have good feeling in their feet, and it just caused these open blisters around their heels. So again, that foot did not have good sensation to protect itself from injury.
So like the first foot,
This
if
one?
it gets that bad, what do you guys necessarily do for the patient?
Well, first of all, this person hopefully is under care already from their doctor, maybe a podiatrist. They would have had x-rays to make sure that none of this opening has, had something that has gone deep enough into the tissue, to the bone. Like I said, this is a bony area under here that it's kind of deformed, right? You can see that it's not a normal shape. So that is what has caused this pressure area, and it's broken through the skin. So any breaks in the skin, even like, we even take for granted, oh, it's just kind of dry, the weather's getting colder, all of our skin is dry. But people with diabetes really have to hydrate their skin with moisture to avoid any kind of a crack that's going to be an avenue or an opening for a problem to happen. But I mean, this could be as minor as just maybe the podiatrist would get this kind of, it's called debrided, but kind of trimmed down around it and cleansed really good. If there's no bone infection, they might be able to treat this just from the outside to heal the surface. Depending on what's underneath this, it could even require surgery.
like also, I have a friend that had an uncle and he's really diabetic. He just recently found out, but his legs would swell up from here going down to his foot, and he would have to rest him up on have him leveled out. And she would have to go in and put some kind of like you said, lotion to keep it moisturized, because you could tell he wasn't like putting lotion on or anything, because his whole leg was like cracking and stuff on down to his foot. So when that happens, do you does a podiatrist or anything of them like tell them to level their legs up so the swelling could go down? Or?
Right, to elevate them,
Yes.
right? So that's a really good scenario thanks for talking about that, because there could be multiple things going on. Hopefully that person is under someone's care,
Yes.
that they have medical care and they're watching their blood pressure, they're watching, some of their lab tests that might indicate why is their foot and leg swelling like that to begin with. There could even be someone maybe should have done like an ultrasound to see is there a clot in there.
That's what I kind of mentioned to her to see, like if there was like a infection or something going on in the inside of his leg, or like you said, a blood clot that's, making it swell up and, be how it is. And so I just thought, seeing that, maybe that was one of the cases of being why, so, with diabetic, your leg will really swell up. If you don't tend to it right away, like you say you should. So that was one of my scenarios that I wanted to touch base on.
Yeah, that's a good one. That's very good. I mean, hopefully, not every person with diabetes, if everything is balanced and they're well cared for, they're on medication they're supposed to be on, they see the doctor, they shouldn't expect to have that much leg swelling. So that could be caused from something else. It could be caused from their heart, their blood pressure, like I said, maybe some medication they're taking is even causing that to happen. So I think that the main thing to know is that you don't have to figure it out. You don't have to analyze all that. Just in terms of your friend and, that being her family member, just make sure they're getting the care and they're keeping up with their care. Like, okay, the person might say, well, I went to the doctor. Well, when do you go back? Like kind of prompting them, what did the doctor do? When is this going to go away? Or what are you doing to take care of it besides just propping them up?
Right.
Because all of this, all of us move around all day long. So at the end of the day, we can put our feet up and it's no problem at all. So I would just prompt them to make sure that they continue to be connected to care. Because we see that too often. We don't want people to like fall through the cracks, maybe someone did tell them to come back, but maybe that day they were in pain and they didn't get the instructions, they didn't understand clearly the instructions. So that's where family members can really be helpful. really would be helpful. But good, that's a good scenario, thanks. So you can see some of these pictures, they're examples of what people might not be able to feel. And we're just cringing looking at this. Look at these little push pins over here. So it's inconceivable that someone does not feel that. Or stepping on toys on the steps, on the floor, like a Lego or something. Imagine. Some of us have done that. Stepping on the hot sand, if the concrete or the surface that you're going to walk on could be hot. Even rocks could, that's going to be painful. They're hard. They're gonna shift around underneath you. And then this one would be just, does it feel good just walking in the grass? They shouldn't even be able to feel that, even though that's probably not something that's going to hurt them. But we don't want people with diabetes to be barefoot anytime. Maybe if you checked out that little patch of grass and said, okay, there's no, glass in there, there's no pebbles or stones in there, they could put their feet in the grass for a while, but to walk around barefoot is risky. It's kind of risky for people with diabetes. So yeah, it's not something that we can understand very well because we haven't experienced it. But this is, for example, things they can't feel. So risk factors, I think your scenario kind of helped us. We talked through this list of things that can accelerate or advance what might have started out as a minor problem into something that really needs care. So people with high blood sugar over many years are going to be at more risk for problems with their feet, because some of them might have even had a foot or a toe amputated in the past, and just that history alone makes them, elevates their risk indication. They should be someone we're watching more closely. They might have a decrease in their vision, or they might, like dexterity wise, they might just not easily be able to look at the bottom of their foot. Their hip hurts, or their and then if they can, their vision might be decreased. Maybe there's not really good light in their home where they're trying to look at their foot. They could have loss of feeling. We already talked about that. Certainly history of tobacco use, or currently smoking cigarettes increases risk for, absolutely increases risk for foot problems, but lots of other problems too. But nicotine, the chemical substance in tobacco, cigarette tobacco, is a powerful constrictor, meaning that it clamps down, is going to constrict the blood vessels. That's just its job. That's one of nicotine's functions for people who are smoking. And so remember, like the cholesterol in that other vessel, we don't want anything that obstructs the blood getting through the vessel. So nicotine is a very powerful vessel constrictor. So we would want our patients to not use tobacco. And we have smoking cessation, people that help with smoking cessation in the hospital, and they're all in the pharmacy. The pharmacists really counsel. They can help people with patches or gum or lozenges of the Nicorette. That stuff's expensive, but it works for some people, and the pharmacists will really be helpful. Our patients like having access to them to help with stopping cigarette smoking. We talked about decreased blood to the foot, any history of ulcers in the past, and then a change in the shape of the toes or the feet. By that, I mean, remember we saw kind of like deformity in that other picture. So I even had a patient earlier this morning, just before I came over here, and he's going to be getting a surgery to fix something that's wrong with his ankle, but that's not until December 3rd or 7th or something. But in the meantime, the side of his foot is he's walking on it differently. And so now it's all heavily calloused and sort of not, the condition of his skin is not right for how he's been walking to accommodate this other problem he has with his ankle. So those are all things that need to be evaluated and considered. So we look today at how can we pad and protect around that area, because hopefully when he gets this surgery to his ankle, that'll fix the problem, and then the side of his foot will correct. But we've got to protect it until then. People ask questions about, well, how does alcohol use, excessive alcohol use, make your diabetes worse, make your foot care worse? And I just tell people it's probably not the exact drink of alcohol or the 1 beer or 2 beers, but it's the lifestyle that happens connected to excess alcohol use. So in another patient, like the young lady described, that person might just said, well, I went to the doctor and they didn't do anything, so I'm not going back anymore. Well, that could be just some thinking that is not healthy for them. And people who are have a problem of substance abuse and addiction, they're not making good decisions. They often run out of their medication and don't take it. So it's more the lifestyle and the choice kinds of things that go along with that lifestyle that are so detrimental in complications of diabetes. And the foot is just one. We talked a little bit about shoes that don't fit well and just pressure injuries, friction from walking and blisters, and then just hygiene. Some people, older people need help with hygiene. They just need help. We take for granted, we just jump out of the shower, towel off, put our shoes and socks on, but we don't really on a daily basis take time to like wash between our toes, rinse the skin very well, dry the skin between your toes, make sure that your feet are moistened with lotion. We don't do that on a daily basis. So there's some of the things that can add to risk. So of course we want to be all about prevention. And I was asked by a group of nursing students one day at Briarcliff, why do I have any interest in dealing with people's feet? Because that might not be, the first thing that you want to sign up for. But the reason I have interest in dealing with people's feet is because I'm basically an educator. I basically have a role to teach people how to live with their chronic disease of diabetes and manage it well. And along those lines, if you can educate someone about risk reduction, just basic daily care, then you could prevent a lot of problems. You can prevent probably between 75 and 80% of foot amputations, partial foot amputations. And those are life altering. I mean, people do not grow back their limb. They surgically have had their life altered. So if we can prevent those things, and if it's that high rate of capacity to prevent something, and really, it's just honestly just by looking. that's I'm not a doctor, so I don't perform any procedures or prescribe any medications, but I can see when someone's foot is getting in trouble and get them to the right care that they need early. And so I just feel pleased that being involved in foot care can have a high yield, a high yield of prevention. So we want always to help people keep their blood sugar levels at the target ranges, want them to avoid and eliminate tobacco, like we talked about earlier, to drink less alcohol. It's recommended 1 drink per day for females, 2 drinks per day for men. And I mean, that sounds good in a textbook kind of setting, but, and that's what's recommended. But I think a lot of us know people frequently who don't drink alcohol like that at all. So it's really the less tobacco and less alcohol is always preferred. Again, things about prevention, I think we already touched on these: washing daily, mild soap, warm water, gently and thoroughly dry the foot, lotion and cream. Really don't want to put lotion between the toes because those would be areas that could be more moist on a regular basis, but you would want to put lotion, moisturizing cream on all the other surfaces of the toes and the foot. And we don't really in diabetes recommend prolonged soaking. Like you mentioned a soap earlier, it does feel good. It's soothing, it's kind of relaxing, but it also is very dehydrating to the skin. So just like taking a very excessively hot shower every day is going to dry your skin more than not. So we don't want people soaking their feet if they have diabetes every day. And so we also recommend that you would ask somebody if, before you're considering, buying something at Walgreens or something that you saw on TV, because they could be harmful. They're not considering that all the people who are going to buy that have diabetes. So it could be something that would hurt their skin. And in cutting toenails, we just don't. My patient this morning, he tried to tell me about some kind of tool he used at home, and I wasn't sure if he was teasing me or not, because I know him very well, but I was just horrified. And I don't think he was teasing me, because I could see what he did. But never, this is the whole never list of never ever. We call this bathroom surgery, which is just not going to have a good result. So we don't want anyone using anything sharp, especially people with diabetes. I mean, you all can trim your toenails and take care of your feet easily without any problems at all, but we don't want sharp, pointed objects can cause a lot of damage. So if the doctor or the nurse doesn't just look at your feet, if your relative is going for a diabetes checkup, just take your shoes and socks off yourself. Just advocate. I try to tell my patients to advocate for themselves. Just say, I think it's time to look at my feet. And then discuss things that you've noticed at home. If you're the person who is getting their medical checkup, just let the provider know that you've noticed some kind of changes or sensation changes. That could be helpful for them to get a good history. So remember your own exam. Personally, you're going to look at your feet first, looking for corns, calluses, blisters, any ingrown toenails or patches of dryness. All these pictures I'm showing you here, they really need either a podiatrist or a doctor to help them. And we do have a podiatrist. He's here every Wednesday morning. Dr. McCarthy, he's a very good doctor. He comes from Sioux City. And you can just schedule people, make appointments, and they can get an appointment to see him for any kind of foot problem.
What was his name?
McCarthy, Dr. McCarthy. Mm-hmm. So if someone has good vision, they have good light in their home, they can maneuver their foot up onto their lap. We do want them just to cut their toenail to follow the shape of their toe. Just file down rough edges. And don't cut them too short, and cut them after a bath because your toenails will be softer then. So we don't want people to cut their toenails way down into the corners because that creates kind of a V shape under the skin, and that's not good. Could cause an ingrown toenail. So we talked about having good light and maybe even having the foot doctor do it. If they're too thick, they could split or they could crack. Because people get sort of thick, dry nails that are kind of unpredictable. And if you have loss of feeling, we mentioned before, have the healthcare provider, myself, or Dr. McCarthy to trim the toenails. So people need to buy shoes carefully too. Don't go late in the afternoon. Have your feet measured. And you really should have a shoe that feels good right when you put it on, with enough room in the box of the toe that all of your toes can move inside the new shoe. So, yeah, these are kind of pictures of different shoes, a tennis shoe, moccasins. There's a puppy and somebody's croc over here. But just kind of shake out and find out for persons with diabetes what might be inside their shoes. Socks should fit well and be not too tight at the top, and don't get the seams, in uncomfortable, lumpy positions, and wear clean socks every day, and don't really have your socks be damp when you put them on. So these would just be looking for signs of infection. I think we talked about most of those things: redness, swelling, pain to the touch, warmth of the skin. Certainly drainage or an odor, or flaky, itchy skin might be athlete's foot. And just having high blood sugar can make infection worse. So call your provider, see somebody right away. If you have any of these things we've talked about, signs or symptoms of infection, a break in the skin, a blister that has rubbed the skin open. And get treatment right away. Don't wait. especially for something to just go away. That's not a good policy. Whoops. I went forward instead of back. So we were just gonna think about risk factors, signs of infection, and why it's important to have routine foot exams at each visit. I don't know if anybody wants to answer one of these questions. I know I've been talking now for a long time, probably longer. Is everybody still muted?
Everybody's still good.
Oh, okay, everybody. Well, I think we covered these things probably more than once. So I'm sure you got the message about risk factors, signs of infection, and getting help, getting care from clinic visits by providers. So I'll just end here, and I want to say thank you. I appreciate your attention. I know this isn't always somebody's favorite subject, but it's mine. It's one of my favorite subjects. So thanks for joining me today. That's all.